Nursing.
Yeah.
Mr. Johnson, my name is Tisha, and I'm going to be your nurse today. Do you have a name you prefer that I call you?
You can call me Max.
Wonderful. Max, if I can take a look at your ID band, and if you can just give me your name and your birth date, please.
Max Johnson, April 1st, 1960.
Wonderful. And it looks like you have an allergy to sulfa. Is there anything else I should know about?
I don't think so.
First, I'd like to ask you about your pain. Before we get started, do you feel up to doing an admission history real quick with me?
I think so.
How is your pain right now on a scale from 0 to 10?
It's not bad. I'll give it a 3.
A 3? And where's that pain located?
It's just right all around my abdomen.
Okay. I'm going to do a full assessment on you as well and take a look at your surgical sites, look at your IV site, and make sure you don't have any swelling or anything like that, okay? Just to also let you know how things work after surgery, we do allow visitors. You can have visitors in your room. We typically like to have one adult visitor, 18 or over, that would stay with you overnight, if you choose to have someone stay with you overnight. We will come around hourly and check on you, and just check on your pain, if you need to get up and use the restroom, anything that you might need assistance with, if you need belongings closer to you. We'll address any needs that you might have on hourly rounding, and when I come in, I will be happy to help with any of that, okay? Or your tech is also available. Jill is your tech today, and Jill will also come in and check on you and take vital signs pretty frequently since you just had surgery, okay? The next thing that you should know about is that we do a bedside report. So what that means is when I go off shift and I bring another nurse on shift, I'm going to tell them about you at your bedside. If you have a visitor at your bedside, I will normally ask them to leave, but if you want them to stay, you can tell me at that time, or we'll have them step out and they can come right back in after we've talked about the surgery procedure and your history and everything.
Sure.
Do you have any questions about any of that?
No.
Okay. Nursing.
Yes.
Hi, my name is Tisha. I'm Max's nurse.
My daughter, Angelica.
Nice to meet you, Angelica. We're going to be doing change of shift soon, which I told you about.
Mm-hmm.
And I want to make sure that I'm taking care of everything I need to do before we're done. And how is your pain on a scale of 0 to 10?
It's still 3.
And also, James will be coming on with you, so I'm just going to go ahead and put his name on your board. In about a half an hour, he'll be coming on shift, so I'll bring him back and introduce him. We'll talk about how surgery went and everything when he comes back in.
Okay.
Okay? Do you have any questions before I go, or do you need anything? Because I have the time to do whatever you need.
No, I'm okay, thank you.
Okay, wonderful. Then I'll be back in about a half an hour.
Okay.
Thank you. Thank you.
Hello.
Fine.
Max, this is James. I told you about him earlier. And James, this is your
Hi.
patient, Max.
My hands are a little wet, if that's okay.
It's
Oh,
okay.
well, good. Hi, nice to meet you, Max.
He has his daughter with him.
Angelica.
Hi, Angelica. Hi, good to meet you.
Nice to meet you.
Yeah.
So, Max, this is the point where we'll do bedside report. I'm going to tell James a little bit about you and how your surgery went. So, if you would not mind, Angelica, if you'd step out for just one moment.
Is it okay for her to stay?
Absolutely.
Sure.
That's just fine. We just do that for your protection and privacy.
That's okay.
Okay. So, James, this is Max Johnson, and he is a 54-year-old general surgery patient of Dr. Pernas. He had a lap chole today with 4 lap sites that have 2x2 tegaderm. We'll take a look at that in just a moment. He's currently running normal saline at 100 through an 18 gauge in his right hand.
Okay.
So, as you can see, these sites all are clean, dry, and intact.
Oh,
They
great.
look really good.
Dr. Pern is a great surgeon. This whole team is really good. So,
That's good.
Thank you so much. So if you want, we can look at the
Yeah.
nursing task list real quick, just so you can see everything is current and up to date on him. We don't have any tasks that still need to be
Okay.
completed.
Good. And they have, that's, looks like all the labs are in.
Mhm.
Fantastic.
He's been taking oxycodone for pain every 4 hours.
Okay.
I gave him the oxycodone about an hour and a half ago, and prior to the oxy, his pain was a 3 out of 10. So what is that now, Max?
It's better. We're probably doing 1.5.
Wonderful. What questions do you have for us before I turn you over to James?
So, does this mean I'm gonna be checked out soon? Yeah.
Hi, Max, Angelica, it's James again. Hi.
James.
Well, I've been talking to the doctors, and we've reviewed everything. You're doing really well. So they've gone ahead and given the discharge, the orders for you to be discharged, which includes some paperwork that I wanted to go over with you, some instructions, and some of these prescriptions. Is this an okay time to discuss that with you? So, and please, if you don't hesitate to stop me with any questions that you might have, and we'll go over this until you don't have any more questions. You feel totally comfortable, okay? So our discharge paperwork, which you can take home with you, it really is broken down into 3 parts. Okay, the first part is about the medications that we're going to prescribe for you to take home, and I've got these prescriptions right here, and I'll talk about that. The second part of this is the follow-up appointment. Now, the other part of this is just about how to take care of yourself after the surgery. Okay, and of course we tell everybody after a surgery that if you later you develop some kind of chest pain, or you get a shortness of breath, or you suddenly start feeling like you're going to pass out and fainting, then something like that would be serious, and you'd either want to get to the emergency room or you'd want to call 911, whichever. Now, I'm just giving you a lot of information, and I'm going to be available, the rest of the day to answer any questions. But I just want to kind of go over a couple of things. Can you kind of tell me about this pain medication we just talked about? It's Norco, and I told you you don't.
Yeah,
want,
right.
How often do you take that?
2 every 4 hours.
That sounds like you've got a really good understanding. What questions do you have for me about any of this right now? Hi, Max. Hi, Angelica.
Hi, James.
Hey, how are you?
Hi. Fine. How are you guys doing?
We're ready to go.
We're ready.
Mm-hmm.
Okay. You ready for discharge?
Yeah, the doc said we could go about now.
Okay. Well, I'm very sorry we don't quite have all that prepared yet, but if you'll just give me a few minutes, I'll go find out what I need to get that done, and I'll be back within about 10 minutes and let you know where we are in that process, okay?
Okay.
I'm really sorry. I didn't know that you'd be quite ready yet, but I'll be right back.
James, the one thing I wanted to tell you while we were in the hallway here, on Max Johnson, I just wanted to show you that he had the vancomycin and the Zofran that needed to be infused. And what I discovered on my hourly rounds about an hour after I got the vancomycin and the Zosyn going in his IV sites is that the vancomycin was running fine, and the Zosyn, I had not opened up the clamp on that. So it was about a little over an hour late. So I went ahead and started a PSN on myself and just went ahead and put that in there. So if you wouldn't mind basically just documenting with me here, stating that you see that it is running and that it actually started going at, let's see here, at 7 instead of, at 7:15 instead of 6 o'clock when it was due.
Okay.
Okay?
Sure,
And then
I'll do that.
I've got everybody that it has to go to already in there.
Okay.
And I don't believe at this point it should throw you off on his antibiotics for tonight, so.
Okay, well, thanks for letting me know about that.
Thank
Yeah,
you.
it's really
Sorry
watching out for
about that.
Well, that's a really good way to watch out for the patient. Thanks a lot.
Okay, thanks.